Everyone, the September 30, 2025 meeting of the Ways and Means Committee will now come to order. Will the clerk please read the roll?
Ms. Barnhart. Ms. Barnhart is present. Ms. Bartholomew McCoy.
Here.
Ms. Bartholomew McCoy is present. You just make sure that you have to put your camera on.
It's on. Camera's on. I can't see you guys though.
Yeah, we can't see you either. Mr. Baines. Mr. Baines is present. Mr. Brew is excused. Mr. Colby.
Here.
Mr. Colby is present. Mr. Dondorfer. Mr. Dondorfer is present. Mr. Keller. Mr. Keller is present. Chairman Mafucci.
Here.
Chairman Mafucci is present. Ms. Smith. Ms. Smith is present. Ms. Vasquez Simmons. Ms. Vasquez Simmons is present. Mr. Udelson. Mr. Udelson is present.
Will Legislator Barnhart please lead us in the Pledge of Allegiance?
By the United States of America and the republic which stands, one nation, under God, indivisible, with liberty and justice for all.
Are there any speakers signed up for the public forum?
There are not.
Is there anyone here who would like to address the committee at this time? The next item on the agenda is the approval of minutes. You have the minutes from the August 26, 2025 meeting before you. They will stand approved unless the clerk is notified of any changes by the end of the day. The next item on the agenda is new business. Mr. Clerk.
Referral 25-0279. Acceptance of a Restore New York grant from Empire State Development Corporation for the Citygate project and authorize entering into a grant agreement with all accompanying grant documents with Streamline Real Estate Partners, LLC, or a subsidiary thereof.
Moved by Legislator Udelson, seconded by Legislator Vasquez Simmons. Is there any discussion? Legislator Baines.
Through you, Mr. Chairman, does the Empire State Development Corporation or does the County of Monroe have any input as an advisor in an advisory role or an active participatory role in the development of the property?
Through the chair, yes, the grant is subject to Empire State Development oversight and regulations. Primarily, Monroe County is a conduit of the grant, but Empire State Development oversight is active and underway.
Through you, Mr. Chairman, would the views of the citizens in the region and in the city, would they have an opportunity heard? Are there opportunities afforded by Empire State Development Corporation or by Monroe County as its designee here to gather input from residents around the question of the development?
Through the chair, yes, a public hearing was held. I don't have the exact date. We can get that. We can get back to you with that information, but a public hearing was held in 2024 about this particular aspect of the project and the grant itself.
Thank you. I yield.
Any other discussion? I do have a very quick statement. I see the hotel is being built. I am wondering, any word from Topgolf?
Through the chair, the developer Streamline Real Estate Partners is in active dialogue with Topgolf, and it's my understanding there have been leadership changes at that corporation, and certain decisions are still in limbo. No, the parcel that has been that is slated for the Topgolf project is ready to go, but no incentives have been granted for that piece of the project by way of Comida because Topgolf is not moving forward yet.
Thank you. And once again, the hotel's being built. It's kind of nice, very nice area. Thank you. Any other discussion? All those in favor, please indicate by saying aye. Any opposed? Item carries. Next item.
Referral 25-0280, amend Resolution 232 of 2024 pursuant to the American Rescue Plan Act, ARPA.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Legislator Baines.
Through you, Mr. Chairman, this funding will provide support for 22 single-family homes in Upper Falls. How will the determination of recipients be made in the event that there are more than 22 qualified applicants?
Through the chair, First Genesis will qualify the home buyers, and they have to be below 60% of the area median income. It would be first come, first serve.
Through the chair, I'm sorry, I couldn't hear that.
Sorry, the First Genesis will qualify the home buyers, and they have to be below 60% of the area median income, and it would be first come, first serve.
So what I'm hearing is that we're going to use first come, first serve. So first to the post, whoever, through you, Mr. Chair, whoever applies first gets it.
They would have to supply all of their income documentation and be qualified.
Through Mr. Chair, how will we be confident that we've communicated the opportunity to a large percentage of those people who may wish to apply?
Through the chair, First Genesis will market the homes when they are ready.
Through the chair, they'll market in what way? Do they have data on the folks who live in the catchment area? Do they have data on the folks who are income eligible and they can contact them directly? Or is this something that individuals have to kind of find on their own? Through the chair.
Through the chair, I do not have the exact marketing plan at the moment, but we can get that information.
Thank you. I would appreciate that because through the chair, it's important to make every accessible effort, if you will, every effort toward accessibility. So thank you. I would love to see what that plan would be. Thank you. I yield.
Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-20281, authorize an intermunicipal agreement with the city of Rochester to accept reimbursement for water usage at Durand Eastman Park.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0282, acceptance of a grant from Health Research, Inc. for the Public Health Emergency Preparedness Program.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Legislator Baines.
Through you, Mr. Chair, what happens to the funding that isn't spent if there's any unspent money at the end of the eligible period?
Through the chair, our experience has been that we've been managed to spend 100% of the funds every year.
I yield.
Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0283, authorize an intermunicipal agreement with Chemung, Livingston, Ontario, Schuyler, Seneca, Steuben, Wayne, and Yates counties to provide public health mutual aid services in the event of a public health emergency.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0284, authorize a contract with Schneider Laboratories Global for the Childhood Lead Poisoning Prevention Program.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0285, authorize a contract with Cure Violence Global to provide a comprehensive training program for violence prevention for the Monroe County Department of Public Health.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Legislator Baines.
Thank you, Mr. Chairman. Through you, Mr. Chairman, is there any provision for key performance indicators for the efficacy of these programs, and any provision for a report to be made to the community or to this body?
Through the chair, there are key measures and there will be data collected. And if this body would like a report, we can submit that when we have it.
Through you, Mr. Chair, I would think it would be really helpful to ascertain the efficacy of this money and these efforts, to see that report. So I would encourage you to provide that to this body. I don't know if I have the authority to ask for it, but I am asking. I yield.
Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0286, authorize contracts with the Center for Youth Services and with Coordinated Care Services as the fiduciary agent for Rise Up Rochester to provide violence prevention services, the Monroe County Department of Public Health.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Legislator Baines.
Through you, Mr. Chairman, as with the prior matter, is there any metric or key performance indicator that will be applied to the application of these funds to the issue of violence prevention? And will a report be provided to the County of Monroe or to this body as at the end of the activity?
Through the chair, again, yes, there is data collection that is part of this, and we have key measures. We'll be able to reproduce a report.
Through you, Mr. Chairman, I look forward to that and appreciate that. Thank you. I yield.
Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0287, authorize contracts with Equally Balanced Therapy and Wellness, the University of Rochester Medical Center Mount Hope Family Center, the University of Rochester Medical Center Public Health Sciences Department, and the United Way of Greater Rochester and the Finger Lakes to provide maternal and child health services for the Monroe County Department of Public Health.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Legislator Barnhart.
Thank you. In its application for funding, all my questions, by the way, are about United Way Rock Families Health Next. In its application for funding, the United Way requested $1.75 million. Why are they being allocated $1.95 million?
Through the chair, the total program cost looks to be 1.95 million. And then as we went through and we're working further within their budget, that is the budgeted number that we came to.
The budget for each of these programs to the
Through the chair, yes, we can.
Thank you. Through the chair to the administration, where does the nurse family partnership fit into this? And is there a reason they're not being utilized for these programs, particularly newborn visitation?
Through the chair, Nurse Family Partnership is a program that is administered by the Department of Health. So it's not something that would necessitate a contract in order for us to provide any funding for it. And through this means, when we're looking at home visitation, it's an ecosystem with different levels of care provided. Rock Family Teleconnects is a more broad-reaching program where Nurse Family Partnership is targeted very specifically towards individuals in a higher risk pool.
Thank you. Through the chair to the administration, one thing that struck me in the application is that these visits have been taking place since 2020. 4,600 newborns have been visited, and the program is currently on track to visit 50% of Medicaid recipients in the city this year. But the application did not have any data about reduced mortality, increased vaccination rates, emergency room utilization, the total cost of care, or anything else that would indicate that this program is effective in improving newborn and maternal health. The only data point that was referenced was reduced depression among moms. I don't consider mere participation in the program to be an outcome. Is there comprehensive data about outcomes since 2020? And if so, can you provide it to the legislature? Because just because it wasn't in the application doesn't mean it doesn't exist.
Through the chair, correct. They do have more data, and that's something that we can work with Rock Family Teleconnects to provide for you.
Thank you. I would really appreciate that. Through the chair to the administration, will there be a control group for this as this proceeds to determine those outcomes?
Through the chair, not specifically a control group, as this is not a randomized control trial. In the way that they're providing intervention, we do plan on looking at multiple data points to determine the effect.
Thank you. Through the chair to the administration, I have a couple questions about insurance, because that was a key theme throughout the application. So one goal of the program is to clearly build the case to show these outcomes, to get insurance providers to cover these visits by 2028. Can you confirm that I did read that correctly?
Through the chair, one of the things that Rock Family Teleconnects has been working on is obtaining the ability to bill. Yes.
One thing that was confusing in the application is, and again, I couldn't take it with me, so I can't refer to it right now, but there are some insurance companies, or at least one, Excelis, that's already reimbursing home visitations. If you could provide a breakdown of which insurance companies are covering visits and up to what amount and how many visits, that would be helpful. Do you think you can do that for us?
I can talk with Rock Family Teleconnects.
Yeah, I swear there were different things cited in this. And so that's why I just want to be clear about what exactly is covered. So through the chair to the administration, if we provide this funding, ultimately, if this is successful, the county won't be asked to fund this again when this program is over, because insurance companies would pick up the tab.
Through the chair, the goal is sustainability, and part of sustainability is being able to bill insurance for services provided.
Thank you. Through the chair to the administration, another ultimate goal of the program is to expand it to universal home visitation to all newborns in Monroe County, voluntary participation, of course. Is there data to back up universal home visitation as opposed to high risk? Is there data to back up visitation to mothers and infants who are not high risk? And I ask this because the application cited some studies that had nothing to do with universal home visitation. I looked them up. And so I guess the question is, can you provide us with studies showing that universal home visitation is something that is supported by scientific evidence?
Through the chair, yes, that's something we can work on providing for you.
One final question. Dr. Michael Mendoza, through the chair, Dr. Michael Mendoza and other staff raised concerns about universal home visitation, saying that there was no evidence. And there was concern that the original RFP for this program was actually rigged for the United Way. And he raised these concerns shortly before he left. Did these concerns have anything to do with his departure?
Through the chair, Brendan Fleming, Acting County Attorney. The administration is not going to comment on that matter.
Thank you. I'd like to just explain my vote. The United Way part of this application is the most expensive part of the resolution. I felt the application fell short for a number of reasons, not the least of which it didn't provide any evidence for universal home visitation. And it didn't provide much evidence for the work that it's been doing over the last 5 years. I do believe intuitively that visits to high-risk families make sense. I'm not convinced it does for everyone. That said, I have asked for this information. I look forward to hearing more. And further, if the program proves itself and insurance ultimately pays, I don't necessarily have a problem with this initial investment, even if it's based on shaky evidence or evidence that simply has not been presented to us so far. So I will be voting yes.
Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Item carries. Next.
Referral 25-0288, acceptance of additional funding from the New York State Office of Mental Health and the New York State Office of Addiction Services and Supports. Amend Resolution 427 of 2024 as amended by Resolution 152 of 2025, authorizing contracts for the provision of mental health, developmental disabilities, and alcoholism and substance abuse services in 2025 for the Monroe County Office of Mental Health.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Seeing none. I need to take one moment here.
Legislator Colby, is your camera still on? Are you still there? Okay. Thought you were, but I heard you on the last one. I just wasn't sure.
All those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0289, acceptance of a grant from the New York State Governor's Traffic Safety Committee for the New York State's Highway Safety Program.
Moved by legislator Udelson, seconded by legislator Vasquez Simmons. Is there any discussion? Legislator Baines.
Thank you, Mr. Chairman. Through you, Mr. Chairman, to the administration. Will the efforts to assess these safety issues be particularly applied to the new blinker beacons that have been installed in the last several years? We've seen a number of them installed. In my old district, there were 2 installed. And I know there are several on East Avenue, et cetera. So that's my question. Will we take a look at motorist compliance with blinker beacons protecting pedestrians?
Through the chair, Major Wagner from the Sheriff's Office. Sir, could you please explain a little bit more about the blinker beacon, what you're referring to?
Well, as an example, through you, Mr. Chairman, if you've been to the MCC downtown campus, for instance, there's a parking lot across from what I'm starting to call Red Wing Stadium again after yesterday's meeting. But, and so a pedestrian will walk up to a designated crosswalk where the pedestrian has the right of way. But in order to enforce the right of way of the pedestrian, we've installed, the county has, in some cases the state, in some cases the towns have installed a device. Often it's operated via Bluetooth and solar, but that one I think is hardwired down there on Maury Silver Way. So the pedestrian then will press a button and an LED blinker will indicate that the pedestrian has done so. And then the question is, will the motorist stop? And that's my question. Are we monitoring those situations to get a sense of whether these blinker beacons are really working?
Sir, thank you. This particular grant and the education and enforcement coupled with the grant, we're going to be looking at all pedestrian, which includes bicycling, skateboarding, skating, safety. That's along a highway, crosswalks with signals, even marked sidewalks or crosswalks, and all of those actions. So if we encounter an intersection within this specific 3-mile radius, we will certainly look at that, but that is not specifically part of our targeted plan. It could be part of it if that exists in one of those intersections, but that is not something we're specifically targeting with this grant.
Through you, Mr. Chairman, this may be out of line, and please tell me if it is, but do you feel that this amount of funding is adequate for you to do the kind of job you want to do to assess all of these issues? Or what would be an appropriate amount of funding to help you really do the job of assessing all these many circumstances where pedestrians and obviously people on people-powered devices like skateboards and bicycles are at risk?
Yes, sir. Through the chair, this specific grant, I understand your question. This specific grant is for one area in the county. It is in the town of Henrietta within a 3-mile radius of the intersection of East Henrietta Road and Calkins Road. And any pedestrian crossings or any interaction pedestrians have with traffic within that radius. Part of the grant and part of the study is to assess the results from our education and enforcement program and determine if it's effective. And from there, we can certainly build upon that to expand it elsewhere beyond that one specific targeted area.
Thank you. And through the chair, does the department have a mechanism for fielding complaints, if you will, from pedestrians or motorists or residents regarding these types of issues, and then kind of prioritize getting out and checking on them? Or is that part of the regular course of business? I'm talking about countywide now. If there's been a number of concerns expressed about a particular, for instance, I'm very concerned about the crosswalk into the MCC building because I use it a lot, and I literally have had people drive 45 miles an hour and laugh at me while the light's blinking, and then the person behind him and the person behind him after that. So is there a portal or some way for people to share their concerns about specific hotspots?
Through the chair, yes, sir. There are a number of ways for folks to express these concerns, and we are very interested in hearing from the community about their concerns. One of the ways there are a number of them, so I won't be able to list all of them, but one of the ways they can express a concern is right through 911. But they can also contact the sheriff's office website, emails. Through the website, they can email specific sections, or even a general email will find its way to the appropriate area for that enforcement or special attention activity. Also, in addition to that, we're very visible and part of the community, working with the community regularly to receive feedback. And things like this are always an important part of those interactions and getting that feedback from members of the community. So yes, sir, there are many ways that can be expressed by members of the community to us.
That's outstanding. Thank you. I yield.
Any other discussion? Before we vote, I would like to follow up something that Legislator Bain said. We installed a blinker in Pittsford, and I drive regularly there, and generally speaking, I see people stop, but there are people who don't. So if there's anybody listening to this, I just encourage you, if you see those blinking lights, be careful, because you just never know. Just because those lights are blinking doesn't mean people are going to stop. But again, I drive by it a lot, and I do see people honoring the blinking lights. So it is a public safety asset. So Since there's no other discussion, all those in favor, please indicate by saying aye.
Aye.
Aye. Any opposed? Item carries. Next item.
Referral 25-0290, acceptance of a supplemental aid to defense grant from the New York State Division of Criminal Justice Services for the offices of the Public Defender, the Conflict Defender, and the Assigned Counsel Program.
Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Legislator Baines.
I'd like to declare my interest. My son-in-law is a senior administrator in the Public Defender's Office.
Got it.
Any
That
discussion?
applies, Mr. Chair, that applies to the next item as well.
Thank you, legislator Baines. Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0291, acceptance of an aid to defense grant from the New York State Division of Criminal Justice Services for the Discovery Reform Grant for the offices of the Public Defender, the Conflict Defender, and the Assigned Counsel Program.
Move it.
Second.
Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0292, acceptance of a grant from the New York State Governor's Traffic Safety Committee for the Child Passenger Safety Program.
Move it.
Second.
Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0293, acceptance of a grant from the New York State Governor's Traffic Safety Committee for the Highway Safety Program.
Move it.
Second.
Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 25-0294, acceptance of a grant from the New York State Division of Criminal Justice Services for the County Reentry Task Force Program and authorize a contract with Delphi Drug and Alcohol Council.
Move it.
Second.
Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Legislator Baines.
Through you, Mr. Chair, to the administration, insofar as the goal is to reduce recidivism through improved coordination for the 418 parolees who will be eligible for reentry. Do we have any data, or will we have any data about the recidivism rates among any cohort, either a prior cohort, a current cohort, or a future cohort? What provision is there to publish the data on recidivism?
Christine Durante from the Probation Department. Through the chair, I can ask Delphi and the Department of Corrections if they have that data available for you.
Thank you. And through the chair, this particular program that for the period of 10/1/2025 through 9/30/2026, is it wired into the grant and the program that this particular group, it references 418, will be tracked over a period of time? In other words, the recidivism is, it depends in some ways on how much duration there is for the program. Is it recidivism within a year, recidivism within 5 years? Is there anything wired into to your knowledge, to the program itself to track these individuals and determine at various periods, intervals, what the recidivism rate will be for this particular cohort that we're about to fund? Through you, Mr. Chair.
Through the chair, I am not aware of the time frame that they would be tracking recidivism for these parolees. I know that the major concentration is prior to release, that they have housing and they're linked with programs and services so that they can safely re-enter and hopefully have job readiness skills to help them prepare for the future.
Through you, Mr. Chair, are the individuals participating in this program voluntary, or is this part of the terms and conditions of their sentences?
Through the chair, I cannot speak to every single participant. Sometimes it is a condition of their parole, but other times they do have voluntary participants.
Thank you. I yield.
Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye. Aye.
Any opposed? Item carries. Next item.
Referral 25-0295, erroneous assessment refund.
Move it.
Second. Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Legislator Donhofer.
Thank you, sir. I would just like to kind of explain my vote a little bit. I'd like to say thank you through the chair to the administration. When this was brought to our attention, you guys quickly looked into the matter and made any appropriate adjustments that needed to be made, as well as obviously fixing the problem that was at hand. St. Joe's is obviously a huge staple in the Penfield district, and we are grateful for you guys taking care of everything that you took care of with that.
Any other discussion? Seeing none, all those in favor, please indicate by saying aye.
Aye. Aye.
Any opposed? Item carries. Next item.
Referral 25-0296, acceptance of a grant from the New York State Office of Temporary and Disability Assistance for the Monroe Ladder Demonstration Program.
Move it.
Second. Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Legislator Baines.
Thank you, Mr. Chair. Through you to the administration, this $3 million grant is for a 16-month program. Is there a provision for what happens to the money if it's not all spent?
Through the chair, I need just a minute to review because I don't know the time frame that was proposed. It's not my understanding. It's 16 months, did you say?
It says here in my notes, if they're accurate, that it'll be for the period from 9/1/25 through 12/31/2027.
Correct. Thank you. Thanks. Thank you. Through the chair, we don't have any indication that we will not be able to continue after that time if we still have additional funding. Through the chair.
Through the chair, is there any metric or key performance indicator that will be applied to this program to determine if its efficacy so that the county can continue to pursue this type of support and provide this program?
Yep, through the chair. So this is actually a demonstration project for the New York State Department, the New York State Office of Temporary and Disability Assistance. So we will have an evaluator. We will actually be entering into a procurement for an evaluator that will help us with the research. And at the end of this, have a product that we will share back to the State Office of Temporary and Disability Assistance so that they can make decisions based on how they might handle, for lack of a better term, benefit cliff issues. The state is constantly working on this issue. They've made some adjustments to the temporary assistance program, and this is just one additional step in the work that they're doing that they chose Monroe to do the demonstration project for. Through the chair.
Thank you. And through the chair, the access to a flex fund to support specific activities on the individual self-sufficiency plan, will that be kind of determined, or what criteria will be applied and how will it be applied to determine how to spend that flex money?
Through the chair. So each participant in this program, again, there are multiple pathways, interventions, I guess we're calling them, as a part of this program. And so if the participant is in the pathway that has access to the Flex Fund, they will be specific items that will support their entry into employment or persistence in employment. I can give you a couple of examples through the chair. Car repair. So if an individual has the opportunity to get a promotion or additional hours, maybe in the evening at a time that public transportation doesn't run, they could access the Flex Fund to have, car repair, some other transportation benefit that would allow them to accept the employment, but it has to be attached to persistence in the employment. So we do have a list of purchases or allowances that are acceptable, but we are continuing to work through this process with the state. And we will also have probably additional input once we hire the evaluator that will help us flush out some of the rest of that through the chair.
Thank you very much. I yield.
Legislator Barnhart.
Thank you. Through the chair to the administration, is this program something that Monroe County had to apply for? And if so, can we see the plan or the proposal?
Through the chair, no, we did not apply for it.
Through the chair to the administration, can we see the plan for the Monroe Ladder Demonstration Program, including the budget?
Through the chair, we actually don't have an approved plan yet, or a budget. But when it's finalized by OTDA, we can make that available through the chair.
Through the chair to the administration. So we're getting $3 million and don't have a budget for it?
We're getting through the chair. In the New York State budget, Monroe County was allocated $3 million that we did not apply for. And we have been meeting with the state, actually since April, May, shortly before the state budget passed, about the offer from Monroe to operate this demonstration project. And it is correct that we do not have a budget. They gave us the funding. We have the award letter. I think it's in your packet. And we are continuing to work with the state on an approved plan and approved budget. There was not a template that was provided by the state. So we have been working with the state for 5 or 6 months now on developing a plan, agreed upon plan. And we actually just today, I was just sitting here, received a request for a detailed budget. So we will be providing that back to the state. We have a outline of a budget, but we do not have an approved budget or finalized budget yet that has been submitted to the state through the chair.
Thank you. It's an interesting backwards way to do it. Not your fault. Through the chair to the administration. So 300 workers, $500 a month. That's less than $2 million. Are all 300 expected for a year? Are all 300 expected to get cash payments, or is that just one arm?
Through the chair, we hope to serve up to 300 individuals. It really will depend on which employers we have, the opportunities available to them for increased hours or promotion. I believe through the chair, I need a second. I have to pull up the plan. So 3 of the interventions include reimbursement. I will clarify through the chair that the benefit replacement is up to $500. Not everyone will have a benefit loss. Number one, not everyone will have a loss of up to $500. And there are additional costs to the program. We will have to procure an evaluator. We will have to procure the benefit calculator access. We have to pay staff to administer the actual program. We have a staff member that we were assigning to be the project manager. There are additional costs related to the financial coaching that will be a part of it. And there are additional costs related to distributing the financial assistance to individuals, because at DSS proper, we issue payments through the state's public benefit system. These are not public benefits, and so we have to create a separate system for issuing payments to individuals. And so there is a lot of other background work that makes up the 3 million. That is not just direct assistance to the participants, through the chair.
One final question, you kind of answered it. So in addition to the potential vendors, through the chair to the administration, will you be hiring a vendor to administer the entire thing, or are you going to keep the in-house project manager?
Through the chair, we will have an in-house project manager. Because this has benefit replacement, we need a staff member who can access public benefits in order to be able to determine the benefit loss. So we have to maintain that internally, but we will have contracted vendors to help with the financial counseling, with the benefit calculator, because we don't own that at DSS, and the evaluator, through the chair.
Thank you. I yield.
One quick thing, since grants were part of my former career as a superintendent of schools, I'd just like to point out that it's not unusual sometimes to have a grant available at X number of dollars, and then you develop your budget to try to spend those dollars, which sometimes you can't. Many times, the grant doesn't even cover everything you want to do. So it's not that unusual. It does
It's a
happen.
nice opportunity.
You know, sometimes you get a set amount and hopefully it covers everything you want. Many times it doesn't, but it isn't unusual to have a budget dollar amount without before a plan. It does happen that way. Any other discussion? All those, seeing none, all those in favor, please indicate by saying aye.
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 Any opposed? Item carries. Are there any other?
We have one more.
Oh, we have one more. Okay,
Yep.
go ahead.
Referral 25-0301, enact a local law authorizing a lease amendment by negotiation with Rochester Community Baseball to serve as marketing agent for stadium naming rights, and an amendment to continue to provide Wi-Fi at the stadium.
Move it.
Second.
Moved by legislator Vasquez Simmons, seconded by legislator Udelson. Is there any discussion? Seeing none, all those in favor, please indicate by saying aye.
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 Any opposed? Item carries. Are there any other matters to come before this committee? There being no other matters, the September 30th, 2025 meeting of the Ways and Means Committee stands adjourned. The next meeting of the Ways and Means Committee will be held on Tuesday, October 28th, 2025 at 6 p.m.